From MBBS lecture halls in India to becoming an incoming resident in internal medicine in Norwalk Hospital in the United States, what does the USMLE journey have it in store for you? Today, we are breaking it down step by step with someone who has cracked it. Hello everyone, welcome to Per Ardua Ad Astra, episode 24, and today we have us with Dr. Lavanya Airen. First of all, congratulations, Didi, on
Thank
matching
you.
into internal medicine at Norwalk Hospital. This is truly such a huge and well-deserved achievement. We are really excited to have you here today to share your experience and all the insights that you can guide aspirant
Thank you
candidates.
so much. Thank you for having me here.
So to begin with, we start with directly taking a trip down the memory lane. What is your fondest memory at Harding?
Oh, fondest memory at Harding. So we used to sit in the steps of the auditorium and we used to have brownie, KKD ki brownie. And I think, yeah, every day we used to have that until they increased the price from 40 to 100.
Could you take us back to the journey, beginning of your journey? What made you decide to pursue USMLE and how did it all start for you?
I started my journey quite late. So usually people who are pursuing USMLE, they started in their first year, but I did it during my internship period. So I thought of USMLE in my internship. That was quite a late beginning. But so initially it was an ambiguous choice because usually people started early. They have lots of things they've already done during med school. So deciding to do that during internship was a hard decision because I didn't know how to start it so late. I had yet to give so many exams, and then people who would apply, I think just right after internship, I wasn't able to do that. So yeah, that was the beginning.
Could you walk us through your complete USMLE timeline from when
Okay.
you started
Yeah.
preparing for step 1 to step 2?
Yeah, I can do that. So I started preparing for, I thought of it during my internship period. So I started preparing as soon as I took that decision. And I gave my step 1, I think at the end of my internship period. Then I took an extension period while I was doing all my electives in the United States. That's when I did my step 2, which was at the end of year 2024. And then because I had already missed the application period in September, then therefore I had to delay my application for the next year. So meanwhile I gave my step 3 in the year 2025, and then I applied in September 2025.
How did you plan and balance your step 1 and step 2 preparation alongside your MBBS curriculum?
I did it during my internship. So internship, it was hard because you have a lot of duties to go to. Also, you have a lot of 24 hours. So I think the most thing that kept me going through is consistency, I would say. Even if I could study for half an hour a day, I would do that. So if I had to go for a 24-hour duty, I knew that I wouldn't be able to study that day. So I would get up at 4 o'clock, study for 2 hours, go to my duty at 7 o'clock, and then next day I would study. So that's how I think consistency is most important.
It's a lot of dedication.
Yeah, it is.
Okay. How did your internship schedule align with your ERAS application timeline?
It did not. It did not. For me, it did not because I was already late. I had yet to give my exams. So for me, internship period was just about giving exams. It did not align with my ERAS timeline. Once I got over with my internship, then I took 6 months extra for my electives and for the extension period. And then the next year, my ERAS timeline aligned with. So I aligned my ERAS timeline according to that. So in internship, it was not.
Did you pursue any US clinical rotation, elective, or observership during your journey?
Yes, I did. So I did a few of the rotations in the US. One of them was at Florida International University, Miami, in internal medicine. The second one was at Yale University, again internal medicine. And the third one was at Norfolk in cardiology.
Okay. How did you build your CV in terms of research, clinical experience, and extracurricular activity?
So because I started my journey late, I had to do all of that after my internship got over. I did have a few things that I was doing during my med school which really helped, which I came to know that would help me in the future in my CV application building. So one of them was when I was volunteering at a non-profit organization. So that later on I found out that can actually add to my CV. So I did that. Apart from that, I joined 2 research organizations after my internship. Which really helped. And apart from that, I was doing as a clinical associate, I was working at a hospital, so that also added to the CV. But unlike The others, I had to build up everything on my own after my internship rather than relying on anybody else. But yeah, I had a lot of mentors with me who helped me through my journey as well. Yeah. It is very different. So in the US, the elective, so basically there are two kinds of rotations there. One is an elective and the other is an observership. Elective is when you can hands-on, you can do stuff, you can talk to the patients, you can take the histories, and then you can even write the notes. But in observership, you don't do that. So I did an electives, so I was able to do everything on my own. It's an important experience where you do an elective because you get to take the histories in a very different way that you do in US. In India, it's a totally different format. You take 2 minutes to take the history and treatment as well. But there you have to take a lot of time to understand what the patient's going through, and then give 20 minutes to the patients and take the histories. So that is different. Also, how they approach the patients are different. The treatment is also different a little bit. So I think getting used to, especially the electronic health records. Here we do everything paperwork. There everything is electronic based. So that is also a different thing that you have to get used to. So learning that system, which is called as an epic system, everything, the different systems are there. So getting used to that, plus how taking the histories and also, that's a little different, but I think you get used to it in 1 or 2 electives.
In your opinion, what makes a CV stand out?
I would say if the CV is able to tell who you are, I think that will make the CV stand out. Because nowadays, usually we kind of tend to tick boxes, the specific boxes that everyone's told to do. And so usually everyone's CV kinds of tends to look very similar. So the only way to make it stand out is to make something or edit something or add something which is very unique to yourself. In my case, it was being an instructor. So at American Health Association, I was an instructor for ACLS and BLS. Usually people do BLS and ACLS certification. I was the person who was giving the certification. So that was kind of a different thing. I think that was also very unique in the form that most of my interviews were talking about that. So that's how you just have to give even just one thing that can make it specific to you. That's okay. You can tick box everything, but just make something that's very unique to what you did. It could be even in the hobbies section. That could also make your CV stand out.
Dabbled in like integrative medicine and like deep learning. So how do you
Which one? Sorry.
the integrative medicine and like you have papers in deep
Yeah.
learning?
So a deep learning, as I said, I associated with two research organizations. So one of them was in AI in healthcare. That's when I started all the deep learning in AI research, and that was also something that I was talking about in interviews. Integrative medicine I started much later. That is something that I started just now. Yeah, after I got, I submitted my application. So that was not in my CV, but yeah, the AI part was in the CV. Yes.
When should students ideally begin the ECFMG certification process within their timeline?
So I think there is no, first of all, there is no ideal timeline because mine was an absolutely non-ideal timeline. I started an internship. So I think there is nothing as an ideal timeline. If you're able to, if you want to go do something, you can just do it in 2 years. It doesn't matter if you extend it after your MBBS. But according to, if you're talking about ECFMG certification, I think that right now, recently, there have been a lot of changes in the guidelines and in the process. So I would strongly recommend that you visit the ECFMG website to see all the recent updates. But if I have to talk about the entire flow of the certification, it starts with giving the step exams. Then you upload the step records along with all the details and documents from your medical college on the, I guess it's the Intel's website now. In our case, it was Oasis. So you do that, and in about a month or two, the ECFMG verifies the documents and gives you the certification. Yeah.
How did you approach writing your personal statement to make it impactful and authentic?
The most difficult part. Personal statement. I think even in my case, I was very confused as to how to write the personal statement, especially in a time where there are a lot of people who help you do that, or who claim to help write your personal statement. In my case, I wouldn't recommend that because personal statement again has to be very specific. It needs to come from yourself. It needs to explain to the program directors who you are and what you've been through. So for me, it was a very different thing. At one of the days at midnight, I think 3 a.m., I had something I needed to journal. So I frequently journal stuff. So I started writing in my journaling book in the midnight. And next day when I read that, I thought that this could actually go in my personal statement. So that's how I started writing personal statements. I think it's good if you listen to your brain, what it's saying. Probably during that time you will have a lot to say, and so it's better you journal, as in my case I did. And sometimes just a line can help you start your personal statement, make it very specific to you.
That's lovely.
Personal statement gets discussed in the interview.
It does not get, in my case, it did not get discussed, but it does. Usually, if you're writing something very deep, it does. I don't think they pay a lot of attention to personal statements for your interviews. However, it is an important thing they consider whether to take you an interview or not. So, in order to see if you're a good candidate for an interviewee, that's when personal statement comes in, but usually it does not get discussed. Yeah.
Right. What are some of the common mistakes that applicants make during ERA's application that should be avoided?
This is important point. So I think during an ERAS application, the number one mistake people do is they lie. Do not lie on your applications because program directors do talk about everything that's written in your CV. So if you lie, you're not able to speak about it, and they get to know about that. So do not lie. Secondly, I would say again, do not consider ERAS application as just paperwork. It is an important thing. It's the first impression that you make to the programs. So make it in a way that it's specific to you, again tells you who you are from the application itself. Another thing I would say, similarly, make your personal statement and letters of recommendation very specific to yourself. And very important thing, submit your ERAS applications very timely, because there is a deadline when you have to certify your ERAS applications. And it's better you submit and apply to all the programs at the deadline, because most of the programs, they select all the interviewees from the first batch itself. So if you submit your ERAS application after a month, there's no deadline to when you can submit. But if you submit these applications to your programs later on, they usually do not get selected. So make sure to do it early.
What factors did you consider while selecting programs and building your application list?
For me, I had a lot of geographical decision in mind. So I did not select 70% of the states in the United States. I only selected a few states on the East Coast. That was my major selection criteria. And then I selected all the programs in that particular state. I went through their websites. I went through everything on the Instagram, on LinkedIn, wherever I can find information from. And then I deselected the ones who are not aligning with my criteria, or probably they're not giving visa, because I was visa needing IMG. So if they were not providing a visa, that was when I deselected them. But elsewhere, I applied all the programs which were fitting my criteria in those states which I had selected.
What strategies would you recommend to maximize the chances of matching successfully?
Maximize the chances of matching. Okay. So I would classify this in 4 categories. Everything that you do before your ERAS application is submitted, during your ERAS application building, after, so during the interview period, and then during your rank order list. I think before your ERAS application, it's very important that you recognize your own strengths and gaps. It's very important that you accept your gaps and your negative points. And if you're able to do something which can overcome them, for example, if you're able to give step 3 in order to overcome your step 2 scores, that would be great. So that's very important. During ERAS application, I think, as I said before, applying early, not lying on the application, on all those things are very important. During interviews, you can prepare through ChatGPT and all. I think that the practice is very important. And again, during interview, what helps is that you're having a very natural conversation with the program and the program directors. Because if it feels like an interview, they do not get interested, because they interview 200 applicants in a matter of short amount of time. So if it feels very natural to them, they usually consider that applicant higher. And the last thing would be rank order list. Very important is signaling. Yeah, I missed, I think, signaling important. So maximum of my, I think 80% of my interviews came from my signal programs. So it's very important that you signal very mindfully. Keep it as 80 10 10. That's what I followed. So I followed like 80% of your signal should go to the programs that that align with your goals, that align with your criteria, and you have an absolute like high chance of matching into these programs that they would consider you. 10% should be all the top programs that you aim for, and you can take your chance there. And 10% should be on all the backup programs which 100% they will call you, so you can take them as backup. That's how I followed it. And signaling is where you have to think about what program would take you. But during your rank order list preparation, that's when you just have to see where you want to match, because during a rank order you've already been interviewed, and so if you have interviewed at a program, there's an equal chance that you would be matching in that like any other applicant in that program. So it's very important that during your rank order list preparation you think about what you want to select, so keep that as your first choice.
Okay. How did you prepare for the interviews?
So interview preparation is, it can seem overwhelming at first, but it is actually very easy. You just print out all the questions from the NRMP website. They usually give out every question. Some of the other I think organizations also give out questions which could be asked during the interviews online, I think Instagram and all. So you can download all those questions, write that down on a PDF, and then you sit with your laptop, try to draft all your answers, whatever you want to speak. And it's very important that you write down key points from every question, because the interview will last 3 months. So it's very high chance that you will forget what to say during the interview. So if you have written down the key points, what you want to say, what you want to convey to the program, it will help you remember those points during interview. It will help you convey your emotions in a much shorter time, because the interviews are only 15 minutes long. Yeah, and using ChatGPT, very important. I think that's one very important use of ChatGPT. You can write the questions and the answers in the ChatGPT, and then you can even practice it using the voice simulator. That's very important. So it helps you feel like you're giving an interview while creating, and it will also tell you what you can do to make it feel like a conversation rather than an interview. So I think that's very important tool. I just use ChatGPT. I did not do anything else, but that's very important. You can do that, yes. And I think a few of the people also use mentors. That is also a helpful way. You can use mentors. You can use your colleagues who are also giving USMLEs. You can help them to interview. Yeah.
What were some of the most commonly asked questions during your interview?
I'm most commonly asked, where in India are you from? Why USMLE? Why internal medicine? Some of them even asked about a particular specific patient encounter you learned a lot from. They do ask about a conflict during your entire medical school, which you again learn from. They focus a lot on your hobbies. So maximum of my questions were from my hobbies, and also experiences part. So anything that you've added in your CV, that gets talked about a lot. Yeah, I think that's it, and it just has to flow. If the conversation is flowing, you literally don't have to answer any questions. It just flows, and they feel it that it's better.
Okay. What do you think makes a candidate stand out during the residency interview?
Again, as I said, so one of my interviews out of all the interviews I had was at Norwalk. Norwalk interview I remember because I do not remember a thing from that interview, because it felt so natural to me that I do not remember a question she asked. I do not remember anything I answered, but it was a 20-minute interview, and it was all about, I think I was asking her about her health, and she was asking me how I am in India. She asked me about, I think, some of the festivals. So I think the entire thing just flowed, and that's what makes you match. You just have to feel like a conversation.
Okay. Were there any unexpected or particularly memorable moments during your interview?
That's it. That was one memory I do not remember anything about.
When you first saw your result, what did you feel in that moment? Was it relief, excitement, or something else entirely?
It was weird. So I expected it to be a very dramatic moment, like you see on Instagram, like all this, oh my God, you'll scream, you'll jump and all. But it was not as such, probably because it was a very long journey. So you kind of get used to those all kinds of feelings that come up. So when you get those results, I think for half an hour it feels very weird because now there's an end to that journey. It's a long journey, and then suddenly there is nothing to do after that. It feels very weird. So I think a day after, I still do not realize that I've matched, but a day after you start to feel those happy. Yes, yes.
What draws you towards internal medicine as a specialty?
Intern. I feel like I'm doing the interview. Internal medicine. So actually, I have a very personal story attached to internal medicine. My grandfather has had cancer. So my grandparents, both my grandfather and my grandmother. That's when I always wanted to be an oncologist, and that's why I took internal medicine. But also because this is one specialty where you get to talk to a lot of patients on a daily basis, and I love talking. So that is one thing that that drew me to internal medicine. Yeah.
All right. What are you most looking forward to as you begin your residency at Norwalk Hospital?
I think just moving to US is one thing I'm looking forward to. But on a serious note, I think the transition from being a student to a provider, that's what I'm looking forward to most. Because in your medical school, even during your internship year, you are in the patient care, but you're not taking decisions. So I think during residency, they give you a lot of autonomy. You can take decisions. You are actually the primary medical decision maker. That I think that just thought of what my clinical decision will lead me to. That's the most important thing I'm looking forward to.
All right. The entire journey from exams to applications, visa processes, and relocation can be overwhelming. Did you face any setbacks along the way? How did you deal with those challenges, and what advice would you give to the students facing similar situations?
Setbacks every day. Because again, it's a very long journey, and so I always say that USMLE is not a sprint, it's a marathon. It's a 2 to 3 years long journey. So every day there is something new that pops up, a new document that needs to be signed, a new thing that you have to run to a CAD section again for, and a new thing that has to be posted online or mailed to them. Every day feels like a roller coaster ride in your USMLE journey, but I think the most important thing is keeping your patience and optimism up every day for 3 years until you match. So yeah, every day you face setbacks. The setbacks will be different for every person. Someone will have setbacks during their exams, some of them will have setbacks during their documentation period, some of them during their electives, finding electives, how to do those electives, and even your ERAS application feels like a big thing. Then interviews, and then the ROL, the rank order list. Everything is a setback because everything's new. We've not been through this process ever in our Indian system. But yes, just patience and optimism.
Okay. Any final message you would like to share with students aspiring to pursue residency in the US?
Okay, this is a good one. So I had a script written out for this, but I don't remember anything of that. But I would like to say that it's very easy to take an obvious path which is in front of us, but it's a riskier one is way more satisfying, the one which has no end to it. So I think even though no matter how big that decision is, no matter how risky that is, no matter how much you feel like you won't match into it, it is the right decision if you feel like it. It will be very uncomfortable, it will be very uncertain, but just with your consistency, I think it will be extremely rewarding.
Okay. Thank you so much, Didi, for taking out time to share your journey with us. This was truly insightful and incredibly helpful for all the students who are navigating the USMLE pathway. Your experience, honesty, and advice are definitely going to make a difference for so many aspirants. It was an absolute pleasure to have you with us today. And to our viewers, if you found this helpful, Don't forget to like, share, and subscribe to Per Ardua Ad Astra. We'll all see you in the next episode. Thank you.
Thank